Hello and welcome to this Crown Commercial Service webinar to introduce you to our new Healthcare Soft FM agreement. My name is Dan McCormack, one of the commercial managers on the CCS Healthcare team, and this webinar is to officially launch the agreement to CCS customers. A bit of housekeeping before we begin. As you can tell, this presentation has been pre-recorded and we will share a recording of the presentation following the call. Please keep your microphone on mute unless speaking by using the mute button in the middle of the screen, and please use the chat function on the right hand side to ask a question, as we should have some time at the end for any questions. I have a few colleagues joining me today, and hopefully this webinar will give you a good overview of the Healthcare Soft FM agreement and what it offers. For anything we don't cover, pop a question into the chat or send over an email following the call. Today, Mark Woods will start us off with a quick introduction to CCS and the framework contacts. Karen Cox will provide some info on the support available to buyers using the agreement, together with some background information, the lot structure and the customer journey. Jackie Harvey will provide an overview of the agreement specifications and terms and conditions. We'll then provide some further detail on the services under each lot. It'll then be back to myself to provide some detail on how CCS will manage suppliers to the agreement before Mike Critchley, our pricing lead, gives a summary of how the framework pricing is structured. We'll finish off taking a look at the KPI payment mechanism and how the agreement incorporates social value and carbon net zero.
CCS plays an important role helping the UK public sector save money when buying common goods and services. We're the biggest public procurement organisation in the UK, and what makes us different to other PBOs is that we're all civil servants. We have no ulterior motive, we are just here to help. We use our commercial expertise to help buyers in central government and across the public and third sectors to purchase everything from locum doctors and laptops to police cars, electricity, and what we're here to talk about today, FM services. The collective purchasing power of our customers plus our procurement knowledge means we can get the best commercial deals in the interest of the taxpayers and deliver significant savings. And just on those significant savings, you can see on screen some of our performance from the 2022-23 financial year. We have £31 billion of public money spent through our commercial agreements, generating £3.8 billion in commercial benefits and savings. And we do all of this through our 20,000 or so customers and with our circa 3,000 suppliers as well. CCS is split into 3 commercial directorates, which you can see on screen here. There are also supporting teams such as customer experience, where our account manager sits, HR, digital, communications, etc. The health category sits within estates as part of the facilities management master category. The FM category covers a wide range of agreements as well as Healthcare Soft FM. We've got agreements for a range of additional categories such as normal FM, security, food, furniture and estates management, just to name a few. The team itself is split into 3 sub-areas. The first one is the product solutions and category management team, who look after the day-to-day running with both customers and suppliers. They look after marketing and are responsible for the development and launch of new commercial vehicles. And this team will be your first point of contact whenever you get in touch with us. We also have an FM support team who are there to provide advice and guidance on call-off activity and are able to offer, subject to resource, almost a dedicated assisted service should you and your procurement teams need support creating and launching your tender. And finally, we have our markets and insights team who take a more forward-looking approach, looking after category strategies, designing and developing new commercial products, and can support customers wanting to look at their own strategy going forward. And the healthcare team itself can be seen on screen here. I'm Mark Woods, I'm the commercial lead for the category, and I'm also joined by Dan McCormack and Jane Bird, and Steph McCarhill heads up our team.
CCS has a dedicated FM support team whose role is to provide additional project and commercial support to strategic FM customers. Support is provided across all 12 of our FM and EMS commercial agreements and will be available to customers of the Healthcare Soft FM framework. A range of support can be given depending on your requirements and timescales. Since it was established in 2022, the team has supported over 60 projects and counting for 34 separate organisations. The FM support team can offer support in various ways, such as, but not limited to, project planning, procurement strategies, specification reviews, bid pack advice and development, terms and conditions, KPI and price matrix support and advice, and compliance support. The services offered are free and there are no charges to customers for this. The Healthcare Soft FM framework is the first time that the FM team has launched a commercial agreement specifically tailored for the NHS. We have previous experience of working with NHS customers through our linen and laundry category, which has been in place since prior to 2008. The latest linen and laundry framework, RM6154, expired in December 2023. Health is a key growth area identified by CCS. The Workplace Health Strategy identified the need for a standalone health agreement for Soft FM. Healthcare Soft FM reflects the latest in NHS standards, specifically in cleaning, linen and laundry, and waste. We have also introduced specific lots for ambulance vehicle cleaning and patient feeding. It is also the first time that CCS has offered standalone waste lots.
A quick overview of the timelines of the agreement. The agreement was officially awarded on the 20th of February 2024 and will run for 3 years up until the 19th of February 2027, and we do have the option of a 1-year extension to take the agreement up until February 2028. Our go live for customers is scheduled for the 29th of March, and in total we awarded to 29 suppliers across 16 individual service lots.
This agreement consists of 16 lots. We have 15 individual lots, which are listed on the next 2 slides. We have 4 linen and laundry lots, 2 cleaning lots, 7 waste lots, and 2 catering lots. Our 16th lot is our bundled Soft FM lot, which is made up of 8 work packages. These include the services covered by the individual lots, with the addition of security, visitor support services, portering and logistics, and grounds maintenance. Customers buying single services will be directed to use the individual lots. The bundled Soft FM lot will be for customers who want to buy multiple services from one supplier or who want to buy a single service which is not covered by the individual lots. Customers buying security as a single service will be directed to CCS's Specialist Security Framework.
Both direct award and further competition are available across all lots on the agreement. There is no threshold for direct award, and there is now additional criteria for buyers to award against. However, CCS would always recommend buyers carry out their own due diligence and seek legal advice if applicable when looking to use a direct award to ensure it remains compliant with the regulations. To access the agreement and request pricing, buyers are required to submit a customer user agreement form to CCS Customer Services via info@crowncommercial.gov.uk. Buyers will then be provided with a contract reference number, and full details on how to use the agreement can be found in the buyer's guide on the agreement webpage.
Specifications. These have been developed and tailored specifically for the healthcare. To do this, we've included all of the standards that are specific to healthcare, such as HTMs, National Standards of Cleanliness, NHS National Standards for Healthcare Food and Drink. There are 5 specifications in total, which span across each of the individual lots. And there are 4 parts associated with the specifications. Part A is a requirements overview. This explains a little bit about core services and additional services, where the standards can be found within the specification document, and government policy and continuous improvement. Part B covers contract management requirements. This covers things like quality management, health and safety, risk management, business continuity, and that spans across each of the individual services. Part C are the individual specifications. We have one for linen and laundry, one for cleaning, one for waste, one for catering, and one for the bundled service solution. And then finally, part D is the changelog, and that is used during call-off if any of the specification is being changed at that stage. Each section of the specification contains a reference that relates to a line within the price model. The specification contains core services and additional services. The core services are the services that the supplier must be capable of providing on this framework. Not all of these will be priced at framework level. Additional services are services the suppliers may elect to provide under this framework, and none of these will be priced at framework level. Terms and conditions. The contract that we have used is the public sector contract procured under PCR 2015 and comprises framework, joint and call-off schedules. The T's and C's generally follow the same approach as that of RM 6232, which is the FM framework that some of you may be familiar with. We have introduced the ability to do a direct award on all of the lots. This provides customers with flexibility. There is no threshold associated with the value, and customers may choose the weightings associated with each of the direct award criteria. Finally, the indexation that we've applied on this agreement depends on the service. For example, on linen and laundry, we have used the textile services cost index, and on catering, we've used a mixture of CPI and FBPI. And then we have used CPI across all other services. Framework prices will be fixed for 1 year following the framework start date. After this, framework prices can be adjusted on each following yearly anniversary.
Across our linen and laundry category, we have 4 individual lots with 4 suppliers. Both direct award and further competition are available across all of our lots. For those familiar with our previous laundry framework, RM6154, the services available and lot structure are very similar, with the addition of a brand new bundled lot. Suppliers are required to provide a patient-centred service that meets the requirements for high quality care and infection prevention and control in line with HTM 0104. All lots include the collection, processing, wash, finish and return of linen items to buyer premises, covering items both hired from the supplier or owned by the buyer. We have 4 suppliers in Lot 1A, which covers your standard linen hire and wash and return of buyer-owned items. Lot 1B offers sterile theatre textiles, including theatre packs, drapes and gowns, with 2 suppliers on this lot. Lot 1C is our brand new lot, included as a result of customer feedback. This lot is a combination of services from Lot 1A and Lot 1B, allowing buyers to procure both standard linen hire and sterile theatre textiles from one supplier under a single procurement. There are again 2 suppliers to this lot. And lastly, Lot 1D is our cleanroom laundry lot, with a single supplier who will be responsible for processing cleanroom garments at the ISO classification specified by the buyer at the call-off stage. We have a range of additional services available across our laundry lots, such as weekend and public holiday deliveries, management of on-site bulk linen storerooms, RFID tagging, and total linen management. Full details of all the services included across our laundry category can be found in our framework specification and buyer guidance.
The cleaning service has 2 individual lots within it. Lot 2A, cleaning services and pest control, and Lot 2B, ambulance and vehicle deep clean services. Looking at Lot 2A on cleaning services and pest control, this comprises of services such as routine cleaning, reactive cleaning, periodic, grounds maintenance, and pest control. These services have been based around the National Standards of Healthcare Cleanliness 2021, and they have been priced at framework level on the functional risk categories associated with the national standards. Therefore, we have asked suppliers to price on functional risk categories from 1 through to 6. With regards to Lot 2B, ambulance and vehicle deep clean, the services associated with that specific lot are the ambulance and deep clean service of the vehicles, a make-ready service, cleaning of buyers' premises, and vehicle decontamination. The waste category is separated into 7 individual lots. The design of the lots aligns with the new HTM 0701 on the safe and sustainable management of healthcare waste. We have also looked towards the NHS clinical waste strategy, which imposes a new set of critical targets for the NHS. And we really wanted to develop a framework that can support the NHS in delivering a more sustainable waste management system. Each of the lots delivers individual services. However, they all deliver a collection, transportation, recycling, treatment and disposal service, and we've also asked for reporting of waste data on each lot.
We have 2 catering lots on this framework. Lot 4A covers the provision of a full meal service to patients, including both inpatients and day patients. Suppliers will provide a healthy, nutritious and appetising menu which complies with food safety and nutritional standards. There are a range of different delivery approaches available, including the use of fully equipped buyer catering facilities, shelled out buyer catering areas where the supplier will install their own catering equipment, and central production units where food is prepared off-site and delivered to the hospital. Lot 4B covers a range of retail catering solutions and hospitality services for visitors and staff, such as self-service restaurants, coffee shops, delis and retail shops. This lot also covers 24-hour catering services, which could be provided by a staffed service or by vending solutions. Again, all retail catering suppliers will provide an exciting and varied food offer, which complies with food safety and nutritional standards.
This lot is for bundled soft FM services and is essentially a combination of all of the lots with some additional services that have been added. The services included in this lot are cleaning, linen and laundry, waste, catering, porterage and logistics, visitor support services, grounds maintenance and security. We have also included CAFM services within this lot. And the reason that we've created this lot is again through engagement. This came out very strongly that there's a desire for some trusts to have the ability to bundle their services together. It's worth highlighting that if a customer wanted to procure security services, for example, we would be directing them to the CCS security framework, which specifically covers all aspects of security delivery and design, and has service-specific security suppliers on that framework. Security within this bundled services lot sits as a work package. If a trust was doing a bundled service contract, including security, then we would direct them to this lot. If the customer were for any reason unable to procure the services that they needed from the security framework, and they felt that this one was more appropriate, then we would of course work with them to support them on the procurement.
As the framework provider, CCS will undertake a number of activities to ensure suppliers to the agreement remain compliant with the framework terms and conditions and the specifications. This includes regularly monitoring insurance requirements, cyber security, ISO certifications, carbon reduction plans, modern slavery assessments, and financial health. In order to be awarded a place in the framework, suppliers have to provide the following: For lots 1 to 4, suppliers must hold a minimum £5 million cover for public liability, employers' liability and professional indemnity insurance. For lot 5, this cover was raised to £10 million. All suppliers to this agreement must hold a Cyber Essentials Basic Certification, or for those small number of suppliers who are a NHS organisation, we do accept accreditation on the NHS Digital Data Security and Protection Toolkit. Suppliers on all lots must have a quality management system that is accredited to ISO 9001, although suppliers to Lot 1 can hold EN 14065 accreditation as an alternative. For Lot 5, suppliers must also have an environmental management system accredited to ISO 14001 and an information security management system accredited to ISO 27001. All suppliers to this agreement must hold a carbon reduction plan, which is to be updated annually by the framework anniversary date. CCS will work closely with suppliers to provide advice on their carbon reduction plans and provide regular training sessions. If they haven't already done so, all suppliers will be asked to complete a modern slavery assessment questionnaire with progress against the recommendations discussed during regular SRMs with CCS. CCS will also regularly monitor the financial health of our suppliers to this agreement, moving quickly to investigate with suppliers when an area of concern has been identified. CCS will maintain regular contact with suppliers, both through individual one-to-ones and regular communications about the framework. We are also on hand to provide any advice to customers and remain an escalation point should you have any issues with a supplier on the framework.
Hello everyone, my name is Michael Critchley and I'm the Commercial Manager for Pricing on this new Healthcare Soft FM agreement. My role sits within the FM support team and is predominantly focused on developing the pricing documentation for use in our framework agreements, supporting or advising customers on the use of our pricing templates and responding to pricing queries. For this Healthcare Soft FM agreement, there are price model templates available for use on the cleaning, waste and bundled soft FM lots. These templates, along with the associated guidance, will be available for download from the CCS website. Customers looking to call off from the linen and laundry or catering lot will be able to develop their own price model. The CCS commercial models are priced at a service line level per building, and in addition to the baseline service cost, contains other financial components you would expect to see where relevant. For example, mobilisation, 2P, billable work, overhead and profit. They also incorporate compliance checking to ensure that the model has been completed correctly. There is also a separate KPI and payment mechanism model to assist customers with monitoring supplier performance and calculating any associated KPI credits. Customers are free to self-serve and undertake their own call-offs using the documentation available on the website. However, if assistance is required, the pricing team would be happy to meet with customers to talk them through the documentation and respond to any queries. A fully assisted service to support the procurement process is also available upon request. Thanks for listening.
Our KPI payment mechanism model gives buyers the freedom to design their own performance measures that focus supplier performance on critical areas for your organisation. When designing your contract KPIs, have a think about what areas of your organisation must function smoothly and would be adversely affected if the requirement was not delivered, or what areas are most important to the organisation, be that government policy considerations, or social value or carbon net zero. Using our model, buyers can determine the weightings of each individual measure based on their relative importance to the organisation. Buyers then input the supplier's performance against each agreed KPI and the model will calculate the amount of deductions due for underperformance from the baseline monthly payment. Deductions are normally capped at 6% of the baseline monthly payment, but can be set at a higher level by the buyer if required. Full guidance and advice on completing the model will be available from the CCS team, so please get in touch and we can talk you through it.
In line with PPN 0620, social value formed 10% of our quality evaluation. At Framework, we tested the following themes: fighting climate change, tackling economic inequality, and equal opportunity. Once live, suppliers to the agreement will be required to submit an annual social value statement and also complete a modern slavery assessment tool questionnaire. The CCS team can provide advice to customers using the framework on how to test social value at the call-off stage. As achieving carbon net zero is a key target for NHS customers, all suppliers awarded a place on the framework were tested on carbon net zero as part of the ITT. They were required to answer questions on how they would support customers to meet the NHS net zero targets and how they would help to educate and influence staff, suppliers and customers to support environmental protection and improvement. They were also required to provide a copy of their carbon reduction plan. Throughout the life of the framework, they will be required to provide a carbon reduction plan which is updated annually and energy and water usage data for applicable services.
So thanks for listening, and as ever, you can get in touch with us about this agreement or any other agreement by emailing info@crowncommercial.gov.uk and just quote RM6331 in the subject line. Make sure the email gets to the correct team. And thanks again.